Being biases. Here we go. Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We're JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. Don't miss Wayne Allen Root, raw and unfiltered, this afternoon from 5 until 8 p.m. only on 1160 AM KBDT News Talk Sports. All right, and that's right, Wayne Allen Root, him and the president have a lot going on together. He was tweeted out by the president of the United States. And so Wayne Allen Root, he'll tell it the way it is, that's for sure. All right, good morning, Steve. Good morning, Patty.
Good morning.
Morning, John.
We've got the Morgan Foundation and Something for Kelly Foundation in studio with us this morning. Of course, it is Tuesday. It is 8:35 here in the Dallas-Fort Worth area. Hope you are enjoying a shift in the weather change. Finally, it's been just dramatically hot and humid. And so finally, we've got some October weather showing up here in Dallas, Texas. But we've got the mental health moment, and excited that Acadia has jumped on board and supported all of our efforts to help get information out in regards to mental health and mental illness. And you guys have a great guest on with us today. Steve and Patty, tell us about Dr. Bethany Teachman.
Thanks, John. We have with us today Professor Bethany Teachman from the University of Virginia. She started the program for anxiety, cognition, and treatment out there, and is heavily involved in the study and treatment of anxiety and anxiety disorders. So we want to welcome you to the air. And Doctor, if you can just tell us a little bit more about you and your lab.
Absolutely. Thank you so much for having me. So I am a professor and the director of clinical training at University of Virginia and a Public Voices fellow with the Op-Ed Project. And I'm very fortunate to work with really just a fantastic team of students and collaborators with funding from the National Institute of Health that allows us to study how people think differently when they're anxious and what we can do to reduce those anxious thinking patterns.
Okay, now let's just jump right into it then. In terms of anxiety and anxiety-related issues, how pervasive is that in society today?
Anxiety disorders are actually very common, and that's why I so appreciate this opportunity to share a little information with your audience. So in any given year, it's estimated that 19% of the American population will actually meet criteria for an anxiety disorder. And of course, even more people will be struggling with lesser forms of anxiety. So this is a really, really common problem. And some people have a misperception and think that anxiety is kind of no big deal. But in fact, when it reaches the level of an anxiety disorder, it can be extremely impairing, affecting relationships, work, school, even increasing the risk of suicide.
That's a great point right now for us all to think about. Could you help us to distinguish between anxiety that might be motivational, perhaps to get you ready for a test or an interview, and one that might be leading towards a disorder?
It's a terrific question, Patty. So you're absolutely right that some level of anxiety is not only normative, but it's actually really healthy and adaptive. So we would never want to eliminate all anxiety, because at sort of moderate levels, it can get us revved up for a performance, motivate us to study for that test. And also, anxiety communicates something really important. It communicates to us that a situation is dangerous and helps us to prepare to respond to that danger. The tricky part is when people start having a lot of false alarms. So instead of it being those kind of healthy, normative levels of anxiety that actually really help us out, instead, people are getting these false alarms and thinking a situation is a lot more dangerous than it really is.
So talk to us a little bit about some of the various types of anxiety disorders. Not all of them are the same, and some might have a greater degree of severity.
Sure, absolutely. So people often think about 7 different kinds of anxiety disorders. So in social anxiety disorder, people tend to fear negative evaluations from others. So they fear that people are going to judge them in some way as not performing well socially, or as in some way awkward or not meeting an acceptable social standard. And these individuals, as a result, often avoid all kinds of social situations that would be really helpful for them to engage in. People who have panic disorder experience something a little bit different. They will have the experience of panic attacks, which is a sudden rise in symptoms that reach a peak very, very rapidly and often involve lots of physical sensations like a racing heart, feeling dizzy, sweaty, all those different symptoms of anxiety. And the person experiences really acute fear. What's critical with panic attacks is that it's less important what happens during an actual panic attack. Those are just uncomfortable. They're not actually dangerous, but it's the ways that people change their life. They stop going to situations because they fear they might have a panic attack in those situations. With generalized anxiety disorder, it's a little bit different. That's a disorder where people have excessive levels of worry. So they think catastrophic things are going to happen in lots and lots of different situations. So they worry extensively about the parent flying home from a meeting. They worry about all kinds of things turning out badly and tend to assume the worst. And that level of worry itself becomes really problematic. So there's many different types of anxiety and ways that they can play out.
Professor, so when you're faced with that type of diversity, what are some of the counseling and treatment methods that can be used to address that mindset and change what could be a very ingrained way of how you look at life?
Yeah. So in fact, while there are different presentations of anxiety disorders in different types, it's nonetheless the case that there are some common factors that tend to go awry when people experience an anxiety disorder. So one of the things that happens across the different anxiety disorders is a pattern of avoidance behaviors. So whether it's social anxiety and the person refuses to give a presentation at work that might help them, or refuses to go to a party that they might otherwise enjoy, or whether it's panic disorder and a person says, I can't go back to the grocery store because I once had a panic attack in that grocery store. We see this pattern of repeated avoidance of behaviors. And so one of the big parts of treating anxiety is helping people to overcome those avoidance reactions, helping them slowly but surely to re-enter the situations they've been avoiding so they get their lives back. Another big piece that goes across the different anxiety disorders is these patterns of anxious thinking. So we know that when people are anxious, they tend to assume the worst in situations. They have what we call an interpretation bias. So when a situation is a little bit unclear, instead of sort of giving things the benefit of the doubt or assuming things are going okay, they'll assign a really negative interpretation. So if I'm socially anxious and I'm having a conversation with you, and you have maybe a neutral expression on your face, or let's say even you yawn during our conversation, I'm likely to jump to terrible conclusions that you think I'm boring, I'm stupid, you don't want to talk to me, instead of thinking that maybe you're just listening or perhaps a little bit tired from staying up late the night before. So this pattern of sort of chronic negative thinking that people have and really getting caught up in negative information and negative cues is the piece that we need to target. And we have a variety of ways that we can do that. We can do it through something called cognitive behavior therapy, where we help people to kind of reevaluate their thinking and learn new patterns to kind of consider different perspectives. We also can use technology-based interventions where we give people practice in thinking in new ways.
Doctor, talk to us a little bit about the rate of comorbidity. I understand sometimes anxiety goes along with depression. Does one lead the other, or how do they relate with each other in a patient?
Yeah, so comorbidity is very common for anxiety disorders. In fact, it's the norm that if people have one disorder, they're likely to have another disorder as well. So as you noted, depression is a really common co-occurring disorder with anxiety. In addition, many people will have more than one type of anxiety disorder. So the person who has social anxiety disorder might also have obsessive compulsive disorder or panic disorder or another type. In addition, we know that people who have anxiety disorders are at higher risk of eating disorders and higher risk of substance use disorders, for example, abusing alcohol as well. And sometimes one precedes the other, and sometimes it goes in the other direction. But we know that these problem areas can kind of feed into each other. And that's why it's really important that people seek help and try to break those cycles.
Seeking help is very important. I'm glad that we're continuing to talk about that, because we do highlight the problems, but we also want to talk about the solutions. So when you're looking at anxiety and depression and alcohol or substance abuse, how do you prioritize?
We ask the person a number of questions to try to figure out what problem is really causing the most impairment or interference in their life. And that's often a place where we'll start to try to get really good traction. And sometimes we find that if we treat one problem area, it actually helps the others without it needing specific treatment. We're also thinking about how can we be most effective. So anxiety disorders are actually one of our success stories in the mental health field, in that we have quite effective interventions that have been supported effectively by research is likely to help people with anxiety disorders. So we also want to pick a treatment target where we think we're likely to be successful, because once a person starts to make some gains, that makes tackling other problem areas easier, and then they can build on those successes.
Doctor, we also know in today's, really where we are today, there is so much that's that stigma is involved and exists in terms of recognizing and treating mental health issues. How does that impact, when you add that to the natural fear a person has, or they want to be liked and they're concerned that they are not liked, how do all of those contribute to make it more difficult for a person to seek help?
It's an enormous problem. So we know that the large majority of people who struggle with an anxiety disorder will not get an adequate dose of a treatment that's likely to be effective for them. So one study, for example, that found that those 19% of Americans have an anxiety disorder found that only 16% of those with an anxiety disorder got treatment that year that they were struggling. So we really have a huge gap in treatment. And there are a number of factors that contribute that you've highlighted. One is the stigma of mental illness and the stigma of seeking mental health treatment. So we know that because people still have judgments sometimes about individuals with anxiety, that some people won't seek treatment because they don't want to be identified in that way. And it's absolutely critical that we break that down. A second factor is that anxiety is associated with avoidance. So not surprisingly, people also avoid seeking treatment because it's a scary prospect to some people to seek help in those ways. A third issue that we have is really a lack of access to providers who are trained to provide the best available treatments in anxiety. There are long wait lists, and it can be difficult to find someone in your area that can provide treatment. And so it's important that we start to think about different models of delivering care so that we can get services to the people who need them.
Interesting. Doctor, we're also finding out more and more as research improves, as our scientific knowledge increases, we are finding that some types of mental illnesses have a biological or genetic base to it. If that is the case, would that help reduce the stigma involved, or what impact does that have when we understand that there could be a biological or genetic base to these types of mental illnesses?
It's a really interesting issue. So, and you're thinking in the same way that a lot of people who work on reducing stigma had been thinking, which is this idea that maybe we won't blame people quite so much for having a mental illness if we recognize that there are biological contributions that are difficult for a person to control that are contributing to the mental illness. It turns out the research suggests that it's a little bit of a double-edged sword, and like so many things in mental health care, it's not a simple story. So when we educate people about biological contributions to mental illness, what we see is that they do tend to blame people less for having a mental illness. So from that standpoint, it's helpful for reducing stigma. What's tricky is that what also happens is people then have the mistaken belief that they are not going to be able to change their anxiety. So they think that because there's a biological basis, that means it's permanent in some way and it can't be shifted. And so it's really important that we simultaneously help people understand that we shouldn't be blaming individuals for having a mental illness, but also that we can change the experience of mental illness and really relieve suffering.
All right. Doctor, don't leave us, because we're going to continue the conversation through the break for our Facebook audience. And so we're going to take a quick break. So Dr. Teachman, don't abandon us just yet. Oh, you hear the anxiety in my voice. Don't abandon
We can
us.
help with that.
No, separation
Okay,
anxiety.
good.
There you go.
Yes. Well, I'm getting a lot of good feedback right now from the conversation. So we don't want to lose it. Some people are using EMDR, in fact, for some of their anxiety. So people are listening, and we appreciate you. Lots of good commentary. All right, we're JP, Kathy, and the crew. We come to you live Monday through Friday. We have the Mental Health Moment brought to you by the Something for Kelly Foundation and the Morgan Foundation, here with Steve Dunn and Patty Giolot. We will be right back after these messages.
Thank you, John, for that.
All right.
Doctor, could you go into a little bit of what EMDR is and how that can be used to help treat anxiety?
Sure, absolutely. So EMDR is a form of exposure therapy. And so we have a lot of good research support for a class of therapies called cognitive behavior therapy, and exposure therapy in particular, which involves breaking down those avoidance patterns that I talked about, helping people to become more comfortable as they are talking about and having experiences tied to the situations that make them anxious. And we know that that can really make a big difference. EMDR is a particular variant of therapy that also involves eye movements or other bilateral movements that are added to the process. So it's important that our listeners know that we want people to seek an intervention that has good research support. And the class of cognitive behavioral therapies really are in that category. And so we can talk about some of the details of EMDR versus another type of therapy that's in that category. But the main message I want people to understand is that there are a number of options available that can lead to good results. And we want people to be informed about which treatments have good research support and are most likely to be effective for the problems they're experiencing.
Doctor, we talk a lot also about family and friends of people that struggle with mental health illness. What should people be aware of? What kinds of questions should they ask? What kinds of statements should they avoid that would trigger or make something worse? How do you support somebody that you know has a mental health issue?
Yeah, it's a good question. So there are a number of things that friends and family can do. One is to encourage people to seek help if the person is really struggling, and to let them know that there are good treatments available that can really make a big difference. And that's especially important because we have data to suggest that people with social anxiety, for example, will often wait 15 to 20 years before they actually go and seek help. So that's one role that friends and family can play. In addition, friends and family can play a role of being kind of a cheerleader, of encouraging people to try things that make them anxious and providing good support to people while they do that. So rather than encouraging avoidance behavior, saying, why don't you try to come to the party with me? I'd really love your company at the party and think we'd really enjoy it. So encouraging people to take those risks, to not avoid, plays a really big role. Friends and family can also just be a source of support and listening, and recognize that struggling with an anxiety disorder is difficult, and to let people know that you're not judging them for that experience and you want to understand what they're going through. In addition, friends and family can ask questions, can say, is there another way to think about that?
Great points, Doctor. I'm sure that the listeners really can take away some very good information from that. That's important.
Okay, so we are about 45 seconds until we're back on air. I know one of the last things we want to address is the website mindtrails.virginia.edu. So towards the very, very end, let's address that, because I know there are a lot of folks that will probably want to jump on that as a starter point for them. So want to make sure we hit that, and then just address possible solutions and the necessity of mental health checkups, that sort of
Yeah,
thing.
I was just going to remind you about that one too. We've got somebody coming in next week talking about mental health checkups and
10 seconds.
normalize that.
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We're JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. Today is Tuesday. That means it is our mental health moment brought to us by Something for Kelly Foundation and the Morgan Foundation, led by Steve Dunn and Patty Giolet. We have a great guest on today with Dr. Teachman from the University of Virginia. And so, Doctor, thank you again for joining us this morning here on the Mental Health Moment.
My pleasure.
All right, Steve, Patty, turning it over to you.
Doctor, yes, we're beginning to hear more and more about the necessity of having mental health checkups, and we're really going to address this next week, but really want to get your input on that. So often we hear people going in for their physical exams every year, but it seems like most people don't go in for a mental health checkup. Could you go into a little bit what that is and why it is so important?
Absolutely. In the same way that we do suggest people get an annual exam that checks on sort of the basics of their physical health, we want to do the same thing for people's mental health. And we want to normalize these conversations, recognizing how common it is for people to experience anxiety, depression, and other forms of mental illness. When people are already going to their doctor or going to their pharmacist or really engaging with a variety of different healthcare providers, we want it to be standard for them to ask how their mental health is. Have they been experiencing anxiety? Have they been experiencing depression? How much are they drinking? So, for example, OBGYNs now will often, when they do postpartum visits for new moms, also ask whether the person is experiencing depression or anxiety. And that's a really important step because it makes it okay for people to talk about the challenges that they're experiencing and allows us to identify problems much earlier, making them easier for us to treat. So we really need to make it the same way that you go to a dentist and you don't hesitate to mention that you're going to the dentist. Same kind of process needs to happen for mental health care checkups. This needs to be a normal part of our health care that is part of the entire population's experience, because we need to make sure that we're prioritizing mental health just as we prioritize physical health.
That's a great point. And I think the more that we talk about this and we use the term to normalize this conversation, I think we can get it into the conversation as we go about that. Now, doctor, not everybody out there has a physician who is as aware as what you're describing, and they may not be asking about these kinds of issues, mental health. So talk to us about your website. Tell us a little bit about how those of us who are out there and need to get some kind of a checkup or some information could benefit by going to your website.
Absolutely. So in-person care is a great option for those who have access to a provider who can afford it, has somebody in their area, etc. But we know most people aren't getting in-person care. And so we've been really interested in using technology to deliver services to people. Our website is called MindTrails, and it's mindtrails.virginia.edu. And at that website, individuals who are struggling with anxiety can participate in our research studies where we offer free interventions to try to shift anxious thinking. So we give people lots of practice in thinking about situations that tend to make them anxious in new ways. So instead of assuming the worst, assuming that your boss is having terrible judgments about you, people can recognize that they don't need to jump to those catastrophic interpretations in a situation. They can shift that thinking style to be less rigid and less negative, and that will help them then to be able to engage in situations in a new way and not feel like they need to be so anxious and avoid so many things.
Doctor, and again, what is that website for everyone?
Absolutely. It's called MindTrails, and it's mindtrails.virginia.edu.
And that's MIND.
And these interventions are all free.
Okay, and that's
That's right. One word.
mindtrails.virginia.edu.
That's correct. Mind Trails is one word.
Okay. Can moms and dads, on behalf of their kids, also go on there and find the information that they may need to help their kids?
So the program is designed for adults age 18 and older at the moment, but we have links there to tell parents how they can find information for youth as well.
Very good.
So there are ways to find services for young people struggling with anxiety as well.
Doctor, thank you so much for appearing with us today. We are...
A lot of great information. Thank you again for the time.
Lots of great information. Dr. Teachman, thank you so much, and have
My
a great
pleasure.
day. All right, we are JP, Kathy, and the crew. Today is the Mental Health Moment with Patty and Steve from the Something for Kelly Foundation and the Morgan Foundation. Thank you guys for joining us in studio this morning.
Happy to be here.
Blessed day. Go Longhorns. And there you go. All right. Anything you guys want to say to Facebook?
Come next week. This is going to be a very exciting week to normalize this mental health care checkup. I think this is the beginning of a new chapter to talk about this ahead of time.
And yes, in fact, next week we have a Dr. Wilson on from Sierra Tucson. And as I understand it, JP, you want to extend the time of the segment a little bit. And in fact, you're going to be leading most of the discussion with him next week.
Next week, absolutely. And we're going to try to talk with him between now and then. And the mental health, I love this mental health assessment and a mental health checkup. We get physicals, we get cars checked up on, we get our houses checked on, but we don't seem to ever do a mental health checkup. And why don't we?
I think it's important that we start talking about it. And what does that mean? What does it look like? What questions are being asked? And how do you probe it a little bit deeper? I think there's just so much out there that we don't even know to ask.
And
I agree.
Maybe we've reached a point where we need to start approaching the counselors and therapists and psychiatrists and doctors here in town, advising that we need to collaborate and put together a public awareness event of the necessity for a mental health checkup and start to talk about it in more of this is a normal, very productive thing we can all do.
Yeah, I agree.
Yeah, I think it's going to be really great because I'm excited to ask these questions or to hear these questions, John, that you're going to have as well, because I think people know what to expect when they go to the dentist or the doctor, or like you're saying, a car, a house. We know what to expect. I don't have a clue what they would be asking about a mental health checkup. I don't know what questions they would be asking.
And Ann Guzman said, good show. Thank you for the help. And thank you. Tess Armstrong, excellent topic. I think I will be going in for a mental health checkup.
That's
Thank you.
Great
there you
news.
go.
Yay.
Excellent.
Move that needle.
Fantastic.
All right, John.
All right. Well, Steve, Patty, you guys have a blessed day. Hook 'em horns.
Thank you. You too. Stay cool.
You too. Be safe driving on the road. Hook 'em horns.
Absolutely. All right, John.
Make sure as you enjoy your breakfast, hook 'em horns.
See you soon.
You got a theme? Do you have a theme there? It's all hook 'em horns.
Absolutely, it is. Yes.
All right. Hey, you guys have a blessed day.
Thank
All
you,
right,
dear.
John. Thanks.
You too.
All right, everybody on Facebook, muchos gracias. Have a great day, and we will see you tomorrow.